Welcome back to the School of Privatization. With our governments there are always new lessons to be learned and covered. Today our lesson will cover private surgical and diagnostic clinics. The Ontario government has proposed two regulations to move public hospital surgical and diagnostic work to independent health facilities. These are sometimes referred to as private surgical and diagnostic clinics, but are better thought of as specialized private hospitals. Our main concerns regarding these changes are quality, oversight, private not-for-profit, questionable billings, fragmentation, threat to community hospitals and inappropriate consultation. Even minor operations can go wrong. We believe that, in contrast with hospitals, it is unlikely private clinics will be able to handle emergencies and that they will likely simply call EMS. Will ambulances be able to move patients to hospitals when things go wrong? Indeed, private surgical clinics first came to public attention when a patient died and the paramedics arrived to find a patient with no vital signs. Is it appropriate to establish a system that inherently requires extra time to effectively treat patients who fall into emergency situations? This is particularly troubling as underfunding and restructuring have challenged EMS response times. The government and government officials must be prepared to accept responsibility for such deaths if this plan is approved. Another recent meta-analysis study found that hospital deaths would increase by as many as 2,200 a year if Canada introduced United States-style private for-profit hospitals into the healthcare system. The studies included data on 38 million patients in 26,000 United States hospitals between 1982 and 1995. The death rate in for-profit hospitals was 2% higher than in not-for-profit facilities. Typically, investors expect a 10% to 15% return on their investment. Administrative officers of private for-profit institutions receive rewards for achieving or exceeding the anticipated profit margin. Also, administrative officers of private for-profit institutions will try to save money, cut the cost, and increase profits in every possible area. In some cases improper cleaning products were used or diluted to a level that cleaning and disinfection were not effective. Also, to lower the cost, clinics were hiring staff with questionable qualifications, knowledge, and skill levels. Physicians were a key force lobbying for this change, so we believe it is inadequate and incongruous that the main form of oversight for the independent health facilities will be the College of Physicians and Surgeons of Ontario. Currently, hospitals must report publicly in a variety of ways. Unfortunately, private clinics fall well short of this standard. Instead of weakening public reporting, we believe it needs to be strengthened. This is a step in the wrong direction. Notably, we have tried to get information about the billings of private clinics and have been stymied repeatedly. We note that the government has promised that the clinics must not be for profit. But the government has refused to share its proposed regulation. Moreover, even if the regulation does prevent this from occurring, this can be changed very easily by future governments. Notably, despite the claims by the government that these services will be provided by not-for-profit providers, independent health facilities are currently overwhelmingly for profit. In any case, profit can be taken from organizations in many forms. The experience in the past is that private clinics aggressively try to find extra forms of funding, often from private citizens. The attempted and failed introduction of private MRI and CT clinics by the former Progressive Conservative government saw the clinics try to bill the public directly for what they claimed were non-medically necessary MRI and CT tests. The government has, just this past summer, gone through a protracted and nasty public battle with private physiotherapy clinics, ultimately revealing that the majority of documents submitted by the clinics did not support their billings. The Ontario Health Coalition has shown that its interviews with private clinics revealed widespread extra billing by existing private clinics. Indeed, the Ottawa Citizen recently has revealed extra fees billed to the public at a private endoscopy clinic. Ostensibly, the government's policy is to integrate health care, but the introduction of clinics obviously goes exactly in the opposite direction. Already the government is closing down community hospitals. By moving core work over to private clinics, this threat is deepened. Clinics will obviously only seek to provide services where they can make money. Instead of providing a range of services, community hospitals will see more and more services creamed off, leaving them with the most difficult and least profitable. The Ontario government recently announced a plan of closing hospitals in the Niagara region. The government is planning to close 5 out of 7 hospitals. This is giving us a very clear idea of where all the services from those 5 hospitals will move. This is a major change in policy. Yet few Ontarians are even aware of this proposed change. We do not believe this very limited form of consultation is adequate. For these reasons we ask the government not to proceed with the regulatory changes that are designed to facilitate the movement of hospital work to private clinics. Please get involved and support the Ontario Health Coalition in the battle against private clinics. Surgical and diagnostic services belong to community hospitals with highly controlled standards, proper policies and procedures, properly trained staff and the ability to deal with emergency situations. Ontario Council of Hospital Union.